where I was someplace I wasn't supposed to be, checking out the new homes in the area, and I did get a tetanus shot, and my arm was a little sore, but like a day, and then it was gone, and that's one of those injections, the tetanus. Okay.
Right. And I think, as Carolyn said, even when you think of something like chicken pox, some people may believe, oh, well, I'll just let them get the disease and,
Not so bad.
It's not so bad. But there's children every year that over 120 children die every year from chicken pox disease. Wow. And, if we can prevent that from happening,
right,
I think it would be worth it.
Right. Now, there are people who can legitimately not participate due to their religious beliefs,
Yes.
and everybody honors that. The fact that the larger community is immunized does help protect them and help prevent them from infecting others if
Right.
they were to get infected.
The important thing, children in school are, they may be exempt from immunizations because of medical or religious reasons.
Okay.
What would happen if there would be a disease outbreak? Those children then who are not immunized would be excluded from school.
I see. To protect them and to protect the others. Right.
Yes.
Okay, that makes sense. So we have this new regulation we want to make sure people know about. And again, you can use your private physician, a health clinic, or the health department in order to schedule and make sure that your children are ready for school this fall. And better to do it this spring.
Yes, yes, exactly. And if you need, a lot of times if you're going to a health clinic or to the health department, they may not have your immunizations on file, previous immunizations. So it's easy to ask the school to make a copy of the immunization record, and then the parent can take it with them when they go get the immunizations.
That's a great idea. So at the, it's looking like it would affect middle school and high school level. So if a parent does not happen to have that handy, or if they've moved recently or whatever, they could ask the school for that record.
Right.
And we do require that at the health department before we would give any immunizations.
Because you wouldn't want to triple immunize somebody.
Right. Right.
Okay.
That's true.
All right. And it is confusing. I mean, as a parent, I find it's very confusing to keep up with what are all the different.
It is. The list is very long nowadays, and it gets confusing with us because we need to know when they had their last shot and whether the timing is proper for the next vaccine.
Now, I did go online. I just Googled immunizations, and I got to, the first site was the federal government, I guess, and they actually, you could print out a schedule of what vaccinations are necessary at what ages, and I thought, well, that's pretty cool. That would make it easier for me, again, as a parent, to help remember.
There's better places than Google.
Okay, tell me, where else where should we send people?
CDC.gov.
Okay.
That's our governing body, and they're one of them that sets the immunization schedule. They have accurate information.
That's easy website, cdc.org.
.gov.
.gov, okay, I apologize, cdc.gov.
And then the American Academy of Pediatrics is another place. It's really important that you get accurate information.
And is that spelled out, or is it acronyms for a website?
You can do AAP.
AAP? Wonderful. That's good to know, thank you. What else do we need to know about immunizations?
Well, I think just again to reiterate how important they are. They've brought tremendous good health to people. They do, like with any medication that people take, there always can be a side effect. And I think, as Carolyn talked about earlier, we have to always weigh that, whether the risk of the disease itself is worse than actually getting the vaccine.
Right.
And also, as Carolyn said, there's a lot of information, very pro and very against vaccines. So just be really educated. I would encourage parents to read a lot of information so that they can make a well-informed decision.
Good. That's great. Anything that you'd like to offer in conclusion?
I guess you talked about your parents. I'm older. I had a lot of these diseases. I can remember my sister being sick. I really believe in the vaccines.
Yes.
I think it's necessary, and we really need to keep our kids immunized.
Well, thank you. Thank you both very much for coming in today. For parents, make sure that you check out cdc.gov for information. You can call the local health department for information, and also check with your child's school nurse if you have, if you can't find the record that you might need, because you need to head to a health clinic, the health department, or your private physician this spring.
Correct.
Okay.
All right.
Thank you all very much. We'll be back for another segment about safety issues. We're back with our second segment of health and safety.